Here.
Vice Chair Moschetti.
Here.
Sheriff Allman.
Here.
Member McGorty.
Present.
Member Miller.
Present.
Member Riley.
Here.
Member Myrtle.
Here.
Member Diamond.
Here.
Member Angelo.
Here.
And for the record, Member Angelo is participating via telephone from a remote location at the Lake Tahoe Resort Hotel, 4130 Lake Tahoe Boulevard, South Lake Tahoe, California. Member Weir and Member Liberty are absent by prearrangement.
Would any members of the public like to make any comments?
Good afternoon, Janelle Rao. I'm a Deputy CEO with County. I just wanted to advise the committee that because you are meeting in board chambers, and we made that determination on this one time, which I'll address later on in the meeting when it comes to the sound and PA equipment, but I wanted to just let everybody know, because we are in here, we are able to live stream. So you are live streaming this meeting, and when we discuss this a little bit later about the sound equipment, should the committee determine to invest money into the procurement of a sound system, you would have that ability for every meeting, because with the sound system, under our remote recording capabilities, we would be able to also live stream as long as we have Wi-Fi. So I just want to let everybody know.
Thank you.
Thank you. So, Ms. Silva, would you like to? Oh, sorry.
Hello, my name is Josephine Silva. Can you hear me?
Yes.
Some time ago, Tom Allman mentioned that it takes a long time to get a facility together. From, I believe it was the jail facility you were talking about. It was something like maybe 4 or 5 years from start to finish. Given that information, I started thinking about a temporary CSU unit, and where possibly that could happen relatively soon without building anything. And then Jed Diamond mentioned to me that the auxiliary buildings behind the old Howard Hospital one of them was used as a interview room for people who had mental health issues. I think I have that right. So what I'm asking is that those, I believe there's 4 auxiliary buildings there, might be considered on a temporary CSU basis, and I don't know what the costs or what that might mean, but to be evaluated. And that, I would think, because the buildings are already there, they're on permanent foundations, they probably pass code, and there is a, I would assume that the hospital old cafeteria setup could be used for food. Anyhow, I'm putting that forth. I'd like to see something happen soon, and that even may be a savings. Thank you.
Thank you. Agenda item 3A, approval of the minutes for the last meeting. Would there be any corrections of last meeting's minutes?
I move that we accept the minutes as presented.
Is there a second?
Allman second.
All in favor? Aye. Any opposed? Agenda item 3B, discussion and possible action regarding update on Measure B project manager. Ms. Angelo.
Yeah, Chair Barris, I hope you can hear me okay.
Yes.
I'll go ahead and start. For the Measure B committee and also for the public, I believe that we did report out at the last meeting that we did do a recruitment. We did make a job offer for the 2 top candidates. That proved unsuccessful, and we went back out. So we have just done another recruitment, and we have received 25 applications, And in doing a first review of the applicant pool from those 25 applications, we have some very good candidates with good experience. And so Human Resources will begin the process of pulling together the interview panels again and scheduling the interviews. We will do 2 panels as we did with the first interview process. And so, again, we're hopeful that the right candidate will emerge. I would also like to make 2 other comments on this position. One being that no work has stopped or hasn't been done because we do not have the project manager position filled. The staff within the executive office and some other staff have worked long and hard to make sure that the RFP has gone forward. We're in that process, and any other action that either the board has directed or the Measure B committee has recommended. So again, no work has stopped because this position is not filled. We will be able to do more work and get more done once the position is filled. I would also like to comment on a letter that we did receive from a member of the public that was transmitted to all Measure B committee members by Cassandra, who is clerking this meeting, and also we did send that letter to all 5 supervisors. I would like to make a couple comments on that letter. One is there is the assumption that the reason that the top candidate, first choice candidate, did not take the position was because of the salary. I would like to inform the Measure B committee that based on the most recent salary action taken by the Board of Supervisors, the position was posted at $80,000 a year plus benefits. The position today is $83,907, so it's almost $84,000 going out the gate. And with benefits, the total package on this position is just under $147,000. Next year, the salary for the Measure B project manager goes up to $87,297. That full salary and benefit package next year will be just under $153,000. The year after that, the salary goes up to $90,833, with the full package being slightly under $159,000. This position is a well-paid position. I also want to comment that I do not believe that the top 2 candidates did not take this position because it paid $80,000 rather than $100,000. As you can see, this position is really just under $100,000, and if you add all the benefits, it's well over $100,000. I believe that when somebody applies for a job, they want to do the work, and they take the job for the salary and benefits that is presented, and also in the classification. And that was not the case with this position. So anyway, I just wanted to be clear with the Measure B committee, and I wanted to respond to some of the assumptions that were made in the letter that you received from a member of the public. Again, if you look at the salary, it's $84,000 as we speak, and just under $147,000 with benefits. Thank you. And I'm open to any questions, Chair Barish.
Would any of the committee like to ask questions? Yes.
How long is it going to take to place a project manager if they do accept an offer? When will we be offering?
Could I ask, is that Member Myrtle?
Yes, sorry.
No, that's okay. I'm just not there, so I'm trying to figure out who everybody is as you speak. We should be scheduling the interviews within the next couple weeks, and the interview process for the first go-round took just a couple weeks. So if we're looking at early October, then we should be able to make a job offer by November. And then it depends. If we're hiring someone who has a job and wants to give a 3 or 4 week notice, then it's possible it will take longer. If we hire someone who currently is not working or only wants to give a 2-week notice, then that would be the case. We do a background as far as checking references, and that background could be done at the same time we are interviewing the top two candidates. So hopefully in November we would have a Measure B project manager on board.
Excellent, thank you.
No further comments? Yes. Would any members of the public like to make any comment? Seeing none, I'll move on to the next item, which is 3C, discussion possible action regarding update on the status of the architect RFQ and related feasibility study.
Good afternoon, Janelle Rao, Deputy CEO. Just a real quick update. As we reported at the last committee, we had received proposals. We have an evaluation panel that it has met. We went through a written evaluation and then invited some of the proposers to present an oral presentation. At this time, we're doing some background investigations and some research on some of the related projects that these folks have under their belt, and we anticipate having a recommendation coming forward. We had targeted the end of October. It may be early November, depending on our timelines for negotiation.
Yes, sir. Yes.
How many responses did we receive?
We received 4.
Thank you very much. Any further questions of the board or the committee? Is there any public comment on this item? Thank you. Moving on to agenda item number 3D, discussion and possible action regarding request for qualification, request for interest in the operations of the proposed crisis residential treatment facility, crisis stabilization unit, and the psychiatric health facility. Mr. Myrtle.
Hi, I thought that it was important to start requesting operators for the facilities we're considering designing. So I'd like to see these processes go maybe not in parallel, but as in close to parallel as possible. So what I would like to see is, operators for each of these facilities, and before we start designing millions of dollars worth of buildings, that we have people that can actually operate them.
Yes, Mr. Diamond.
I don't quite understand how that would work. I'm not familiar with the process. How would you see? Sounds like a good idea to be able to get some sense of what operators would be available and who might be interested in operating these kind of facilities. But what's the practicality of how do you go about doing that?
Well, I think the process would be similar to what we're doing with the architects. We sent out a request for qualification and a request for interest in the operations of a crisis residential treatment, a crisis stabilization unit, and a psychiatric health facility, and see who responds. Carmel or Janelle, can you help me with this?
This is Carmel. I'll go ahead and jump in. So you basically, if I understand, and I apologize, I don't have the actual agenda item in front of me, I just have the agenda. But basically what you're saying is that we would move forward to do an RFP, or RFI really, or qualifications, just to see what operators are out there and what the interest is. And then, depending on that, we would then go back to the Measure B committee and determine if we wanted to actually let an RFP for the service. Am I following you, Mark?
Yeah, I'd like to make sure that we have operators that are willing and able to operate these buildings that we're planning on building. So I thought that would be a prudent thing to do.
Yeah,
so yes.
And I think that I don't, obviously the committee will decide and vote. I think it's precautionary, as far as your request, and I don't think it's an unreasonable request. I don't believe we could let a contract at this point because I believe we have to have all of the money in advance before we could actually contract with the provider. And I'm going to leave that one alone. We don't have to get into that right now. Sally's on the phone and certainly could respond at a later date. But I think as far as doing the RFQ, RFI to see who is out there and who is interested in working with us, I think that that's a reasonable idea, and I would just ask Deputy CEO Janelle Rawl if she has any follow-up on this. Thank you.
Janelle Rao, Deputy CEO. I echo what CEO Angelo mentioned. I would also caution the committee that there are a lot of moving parts and a lot of folks involved in this, including the agency, the HHSA agency, as well as our board. So anything that we're doing from this capacity and any scope of work that we would be looking at from a service provision, those parties would all need to be involved prior to soliciting. So starting the process, starting the dialogue, coming up with a potential scope of work, I believe is something that would be valuable. And then determining how we involved all those other parties, also including the Behavioral Health Advisory Board as well.
I think it's really important that we think about what's going to be provided, the services that are going to be provided in these buildings. I think it's a little premature to ask for people to step up to the plate because we don't really exactly know what it's going to look like. You know, how big the building is, how many people it's going to serve, you know, how many beds there are going to be, and we don't have a list of the requirements for each of the facilities, so it'd be really hard to say, well, we need this and this and this and this, and we know there's a shortage of psychiatrists, and we know that we need certain people, but I think it'd be good to concentrate on other things like getting a psych tech program at the college so that there's people to hire when the time comes.
I'm sorry, I can't see what's happening in the room, but Mr. Veras, when I could make a comment, I'd like to.
Go ahead, Carmel, that's fine.
Thank you. I do believe that when we put together the RFP for the buildings, that we had very good information and work done by Health and Human Services, and we did spec out the size that we were looking at of basically how many beds for the 3 facilities. And given that I'm basically making that statement on the work that Health and Human Services did, I'm not sure if Janine or if Tammy Moss-Chandler is in the room and would also like to comment. But I say that only in response to Member McGordy's comments, which I think are also reasonable comments that I could see why the committee would say, well, why are we doing this now? But I do think we have enough information to put out a request for information just to see who is out there and who is interested. Thank you.
Thank you. Yes, Saradi.
Thank you. I'd just like to say that I support the recommendation. I also understand the concerns, but I think we do have enough information to do some preliminary analysis of a potential operator. That's one of the concerns that's been repeatedly expressed amongst this committee and also the public is, what if we build this facility and can't staff it, or it's not sustainable? And I think this would be the beginning of gaining some confidence in that, hopefully confidence in that, and in that we could look at any respondents' performance or programs in other areas and start to get a better handle on what it's going to cost to operate this facility, because I think there's too many unknowns about it. And also I think we would all feel better knowing that there are people interested in operating this facility, and currently we don't have that.
Thank you. Any other comments from the committee? Right. So is there any, would anybody like to make a motion regarding this item?
Yeah, I'd like to make a motion. I'd like to make a motion for a request for qualification / request for interest in the operations of the proposed crisis residential treatment facility, crisis stabilization unit, and the psychiatric health facility.
Second? We have a motion and a second. All those in, is there any discussion first? Yeah, all of those,
So-
yes.
So my question is, and this deals with the RFQ that's gone out, right? That's gone out. And Janelle, could you come up? So the RFQ that's gone out is for what services? Because we have two different animals here that we're trying to contain. And while I support the motion, I think that the motion should somewhat go hand in hand with what we have already done, so we're not wasting time. So
Janelle Rao, Deputy CEO. The current process that we're in is for architectural services, feasibility study, and CEQA for the construction of a CRT, CSU, and a PUF, 24-hour psychiatric health facility.
So it could be one building, it could be two buildings, it could be three buildings.
Correct.
And so we're just putting out an RFQ for, show us what you can build, and in your motion, Mark, is if we have what we're talking about here, and you're a company or an organization that could run it, we want you to be aware, you tell us who you are so we can start working with you and get more information.
Basically, what I'm saying is before we go through the whole process of designing a PUF per se, if we don't have an institution or an operator to operate it, we may consider going through with the design, but definitely not going through with the build. So that was my thinking with doing this, is making sure that we have the personnel or the operators to operate these facilities.
Good. I just wanted to add, Carmel did note that the RFP noted approximately what the max number of beds we would want in each facility. Because if you go over 16 beds, we can't bill Medi-Cal. But the other important feature here that I think kind of coincides with what Mark is saying is that we can't have the same operator operate both facilities. If you have a CRT and a PUF within our community, the Medi-Cal combines the beds. So it is looking at, do we have enough operators that could operate the multiple facilities so we can still bill Medi-Cal? And then, sometimes your facilities are combined. So we may have a CSU within our PUF, and that would be interesting to see if you had an operator willing to do both of those and what their interests were.
Janelle Rao, might I suggest in your clarification to your motion, I would assume that you're requesting that this recommendation go to the Board of Supervisors?
Yes.
For the Board of Supervisors to then give direction to HHSA to proceed with the development of some form of scope of work?
Well, that's what our recommendations are. If we vote to approve it, it's just going to the board for approval, right? Or do I need to qualify exactly how the RFQ is going to be?
I would just suggest
stated?
you put some specifics in there about it going to the board. Because then the board, whatever action is coming to our board, it will need to be a little more clear.
I'd ask the board to approve this request for qualification, request for interest in the operations of the proposed crisis residential treatment facility, crisis stabilization unit, and a psychiatric health facility.
And for the public's information, and I appreciate you bringing this forward, as far as I can remember, as far as Measure B Commission goes, this is the first time, it's the first move we're making to say, all right, you people who say you want to run this, it's time to come forward and tell us who you are. I mean, this is a giant step forward to move forward, and one of the reasons I'm going to support this is because I don't want it to be a RFQ that's going to give the respondents only 3 weeks to respond. That's not fair. But some of these things do. You know, government tries to rush things at the last minute. What we're doing is we're saying, prepare for the official RFP that's going to be forthcoming. That's really and truly a big first step.
Let me qualify. All I'm trying to say is, can we place a letter, and it could take as long as it needs to be specific in the description of a CRT, CSU, and psychiatric health facility, but we're looking for people to operate these facilities other than county staff. So that's the request that I'm submitting. If I need to state it more clearly, let me know how I word it, but I think I've worded it properly.
Go ahead.
Could I please have a repeat of the motion?
Motion for the board to approve the request for issuance of a request for qualification, request for interest in the operations of the proposed Crisis Residential Treatment Facility, CRT, Crisis Stabilization Unit, CSU, and the Psychiatric Health Facility, PUF.
We have a motion and a second and discussion. All those in favor of the motion, please say aye.
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 Any opposed? The motion carries.
I'm sorry, Mr. Chair. Christian Curtis, Assistant County Counsel. Just since we have one member participating by teleconference, the code does require that the votes be by roll call. I know that's going to be a little inconvenient, but I believe we need to proceed in that fashion.
Carmel, would you like to state your vote?
Did you ask for, this is Carmel, my vote is yes.
Okay. All right, thank you.
Roll call.
You have to do a roll call vote. Roll call, okay. So you'll have to enlighten me as to what that means, so everybody has to say individually?
She'll name call.
Okay, all right.
Chair Barish,
Yes.
Vice Chair Muschetti,
Yes.
Sheriff Allman,
Aye.
Member McGorty,
Yes.
Member Miller,
Yes.
Member Riley,
Yes.
Member Myrtle,
Yes.
Member Diamond,
Yes.
Member Angelo.
Yes.
Thank you. Are there any further comments of the committee? Would any members of the public like to make any comment? Thank you very much. Moving on to agenda item 3E, discussion and possible action regarding further options with Measure B services. This was in response to Mr. McCowan addressing this committee last time and asking that we spend money for services that, or authorize spending of money for services that could be used immediately rather than waiting for facilities to be built. He said, why don't we follow the services as outlined in the Kemper report? I would like to say that I agree with Mr. McCowan that there are a lot of services wanting in the county, and it would be disappointing not to supplement the system. I'm particularly sympathetic with the needs on the coast and their geographical isolation. However, I wanted to state that before embarking on any further spending, we should have a reasonably accurate accounting of how much money has already been assigned to the buildings that we've recommended, as well as the services that are attached to them. Also, an estimate of how much we expect to take in from the measure. Also, I don't think spending on services is at all simple or straightforward issue for a number of reasons. First, we have to decide as a group which services on which to spend. If we were to donate $1 million, for example, to whom would we give the check and for what? Lee Kemper, in his report, gave very general recommendations regarding the categories in which the money should be spent, but his report still needs to be interpreted as far as specifics. This would probably involve another needs assessment to determine priorities and details regarding which agencies are equipped to supply these services. then we'd have to also have a process in which to administer our grant and track deliverables, for which we would need possibly the project manager to do. Another issue regarding spending on services involves determination of why provision of some services have been unsuccessful and how we might be able to do better in the future. For example, much of what's needed involves hiring therapists. We have a great deal of difficulty hiring and retaining them, have had in the past for several reasons, particularly the differential in salaries between our system and those of Sonoma County, as well as the difficulty in obtaining housing in Mendocino County. I think in order to improve our present system, there must be a concerted effort, which is not in the purview of this committee, though making sure the money is well spent is in the purview of this committee. On the other hand, if we all can agree that services on the coast are, a priority, I think that spending may be more straightforward. For example, many seem to agree that to buy the Afanito building in Fort Bragg and help providing a location for provision of services would be worthwhile. And certainly this would involve a lot of further discussion. I had a further item that I was advised I should withdraw under the particular status of the negotiation happening with the architect applicants. Yes.
I just have one comment. I'm fine with the services thing also, but as our chair stated, there's a lot of things to decide. You're not supposed to speak that way.
What?
Anyway, my major theme is that were we to ask the Board of Supervisors to spend money on services to certain organizations or anything like that, that organization would have to provide what services they will and are capable of providing with monies given to them, form a plan for those monies, because you can give monies to people, and if they can't spend it or they can't provide services, you're just throwing money at a problem. And that's just my personal opinion. Thank you.
Any further comments of the committee?
Chair, I
Yes,
have one.
yes.
And while Lloyd Weir isn't here today, I believe the step we need to take before this, and while I appreciate his budget summaries that we get each month, one of the things that we realize is 75% of the monies most likely will brick and mortar and 25% toward services. And the budget that we're getting, or the income that we're getting, hasn't been separated like that. And so while I support finding out what these services are, I think the first step is to, in black and white, know what monies we're talking about. So there is a commingling right now because we have one account for the Measure B monies. But in truth, we're going to be having two columns of money, 75% and 25%, that we need to focus on. And that's something very important because in less than 4 years, the 75% goes away and the 25% remains. And so that's to go along with your motion. I think the first step is to clarify the monies. Thank you.
Mr. Myrtle.
I would be in support of services. I agree with Donna that we need to be specific in the services we support, and I wouldn't suggest just allocating money to, in general. It would need to be for a specific allocation. We have $9 million right now, and we're not doing anything with it, so I can appreciate everyone's frustration with that. If I were to support services, I think it would only be for a pilot program that we're not committed to 100%. So if we need that money down the road and we find that the pilot isn't giving us the return that it's costing us, that we can terminate the project. So I'm in agreement that we need to spend money on services. I'm not sure what services they are.
I really liked what the sheriff had to say about dividing it into two parts. I think we should think about three parts and have one of them be the prudent reserve that was recommended, that we haven't decided upon exactly what it is, but I mean, it's good to have it there in case there's a recession or in case something happens to the building, so there's backup.
Thank you. Mr. Diamond?
I appreciate what everybody's said, and what struck me, Chair Barish, of your comments was that we have already set priorities for 3 fairly large programs, and we also are still have a number of steps to go before we really know what it's going to cost. And so I would be reluctant to spend money in anticipation, assuming we would have money, till we really know how much it's going to cost, and we really had done what the sheriff had recommended to separate out how much is it going to cost for facility, how much for the running of it, and Ms. McGordy's. Also, I think having a prudent reserve is something we should be aware of. Now, in the Kemper report, as we know, there was indication that there would be enough money over the period that we're talking about to have other services than the 3 that we have made priorities. But until we know in a sense, the nitty-gritty, how much is it really going to cost compared to what is estimated in a report, I think we would be putting ourselves at risk if we began spending money on program, because money's there, if we don't know the long range of how much we're going to need.
Thank you. Ms. Riley?
I agree that there's a tremendous amount of uncertainty about what all these costs are going to be. I want to clarify one thing. Measure B specifically states that a maximum of 75% will be spent on facilities. That's up to. So I guess I'm not opposed to dividing the budget into facilities and services, and I think we absolutely need to have a reserve. But there also needs to be an understanding that that should be flexible as situations change. It is up to 75%. If we do an amazing job of providing services up front, if we do an amazing job of preventing mental illness or crisis, then that could eliminate part of the need for facilities down the road. And we don't have enough information yet. I think what I'm hearing from this was a letter from, was it Supervisor McCowan?
No, Supervisor McCowan spoke to us last meeting, and this is just my response.
Oh, that's your response. Okay. Thank you. I think we do need an analysis of the services that are being provided. The mental health budget, and correct me if I'm wrong, is already over $20 million. And before we start looking at let's invent a new program, I think we do need to take a closer look at what we're doing and what's effective. And only then can we know what needs to be supplemented, what needs to be replaced. And so I think I don't know what it looks like, if it's an audit of the services, and I think this is something that the county should be interested in. I don't know that this is necessarily a Measure B responsibility. Somebody does need to be taking a very close look at the services that are provided and saying, what's working? Can we expand on that? Is it a money issue? Is it a resources issue? And where can Measure B be most supportive?
Thank you. Ms. McGordy?
I really like what Member Riley had to say about that. And I just wanted to comment that my understanding is most of the county money, most of the money that's being spent on mental health goes to severely mentally ill. And what you're suggesting is to prevent people from being at the severe point, you have to do things ahead of time, which we don't spend money on. So I really like the idea of having an assessment of what services are provided and seeing maybe some kind of survey or community meetings, something to see where the need is. I really agree. Thank you.
So I just wanted to add really quick, I know that Shannon had asked about the mental health budget, and one thing I want to remind everybody, that's not guaranteed dollars. So when you say the mental health budget is 20 million, don't forget, usually 50 to 60% of all those dollars is federal financial participation reimbursement dollars. So we have to provide a service and get reimbursed. So I just always want to clarify that, because it's not just money, it actually has to be a Medi-Cal billable service within Medi-Cal billable regulations. We put up about a 50% match, we get a 50% match back. That's how mental health services work regarding especially mental health services. We do have MHSA dollars that works a little bit different, but I also agree that when we look at the county system is a small part of the mental health services within our community. We only serve the most severe, and I think what I try to explain to people is we're the specialist. You go to your primary care for most things, and then when you get to the level that the primary care can't treat you, they refer you out to a specialist. That is your specialty mental health services. We serve the most severe. We are the specialist. I did ask our QMC recently to try to do an analysis, and I know that they were pulling it together, and so I don't want to misquote. I know Dan's in the audience, but to really look at what are we seeing? When we look at crisis and the number of crisis assessments we have coming in our door, I mean, if we want to look at it, at services and what we need, we have to look at our numbers. And we do have a lot of data in relations to specialty mental health services. We don't have the data in relation to mild to moderate that have Medi-Cal or your private insurers, right? Because that is not the information the county has access to. But we were looking to see when we see people coming in crisis, because that's one area where we see everybody regardless of insurance. What is the majority of those people walking through the door? Are they people that are especially mental health clients currently that are needing to be rehospitalized that we are currently working with? And the answer is no. That the majority of the individuals that are walking in through crisis door, I think we thought about 65% are individuals currently not being served by the specialty mental health system of care. And so I think it's important when we talk about, if we're going to talk about services, we've got to talk about that 65% that we need. How do we prevent those 65%? And how do we get them services and in the right level of services that they need to be treated?
Thank you very much. Any further comments of the committee?
I do. And I don't want to go so far away from Measure B that we're in the behavioral health realm, because that's where we're going. But I think that there is a time that these two committees can have a marriage there. But I appreciate the prevention of mental health, and one of the things that we have not really discussed or anything to do with juveniles. And I had an opportunity to speak to someone who would know, the number of juveniles compared to adults, and certainly it's much lower. It's where we might have 7 adults out of county some nights in placement homes. We might have 1 or no juveniles, and I wouldn't even know where the closest juvenile treatment facility is. So it's one of these sticky webs that once you touch, you can't let go, because it connects to everything else. And I certainly appreciate this conversation, and we don't know what we don't know. And so going back to the last motion that you had, of Sheriff, that we're talking about now, we need someone to come in with a brilliant idea. It's not like Mendocino County has ever been in a situation that says, we have all this money, please bring us a solution. But we don't have all this money, but we certainly have money, more money than other rural counties have. And we're hoping that someone's going to be out there saying, I have a solution, and in black and white, this is how we can do the solution, and this is where the preventive services, the ongoing treatment, and the follow-up of recovery, and hopefully getting them out the door and not coming back is where we're going to go. So it's just an editorial comment. Thank you.
Mr. Myrtle, did you have?
A lot of what we're talking about sounds much like we discussed 3-4 meetings ago about the MOPS, Mobile Outreach Prevention Services. Is that program still in operation? And what happened to our request that went to the Board of Supervisors? Who knows the question?
So if I may, yes and no. The main coordinator of MOPS retired, and she was a critical person to the ongoing, consistent operation of MOPS. The director of human resources for the county retired, and she was working on this. This was her project before she retired, and so it's come to a somewhat standstill. And I've been meeting weekly with human resources to get it back online. So, and that's one of the reasons that I think we should separate the monies, because this is money that the board has obligated, but it's still going to our bank account, but we haven't spent it yet. So the money's not going anywhere, and I know we need those services. It's just some other positions. Yeah.
Yes, Ms. Miller.
So I just want to respond also to that. So we still have 2 MOPS units that are in the field. It is only the mental health rehab specialist at this point. We do not, the sheriff technician we had retired. So we do have 2 teams. We actually have 2.5 that are still out in the community serving the area. It is the mental health rehab specialist solely at this point. So we haven't gotten rid of MOPS in that perspective. We have not added any additional teams. But I think what we have to remember as a committee is the funds that are funding MOPS right now were grant funds. And those 3 teams that we have are on a grant funding that is projected to end, I believe, in 2 years. So if we add additional teams, we're also going to have to be aware that the 3 teams we currently have that are funded are going to be running out of grant funds.
Thank you. Any further comments from the board? Any public comment?
Joe Bradley, Little River. I've been listening to all this, and I think it's all well and good, and I think MOPS is a good idea, but we just bought a building for training, and I know that's the next agenda item, so I've been keeping quiet, but I think when we start talking about the money and where to spend it, if we have a building and we can get it fixed, or even at, as a big empty building, start training, I think that will go a long way to help with mitigating problems. Just that in itself, I think, would be really, really helpful, because we've already spent money on the building. I'm presuming everything went fine and the escrow closed. So I think I would like to see that. I also took the time to read the whole Measure B. And I would suggest you've probably all read it at least once, maybe twice, but to read it again, because the way I read it, it's for the facilities and some training. And yeah, it's 75-25, but not a whole lot of services. This was for buildings. So I just want to make sure that that stays clear, and that you guys stay focused so the public doesn't go, oh my God, you were supposed to do this. And then if we want to start working on anything, I would work on the training, because we're closer to that. Thank you.
Good afternoon. My name is Maya Stewart. I'm with Adventist Health. This is my first Measure B committee meeting, and I'm very pleasantly, I'm not going to say surprised, I'll just say pleasantly. And I wanted to comment on a couple of things. First of all, I do think that this is a really huge step, as Sheriff Allman mentioned, just talking about moving forward somewhat in parallel with architecture and requests for interest from potential operators, because who knows how helpful or beneficial those could potentially be to each other. Mostly, though, I really wanted to grab onto what Ms. Miller was mentioning about the $20 million in mental health funds that we supposedly have. As a member of the public and a voter, I don't think we can ever hear enough that is an up to amount. It's not just money that we get. It's way more complex than I understand, but just knowing that it's an up to amount, I think makes a big impression on the community. And also that what isn't covered. when we start talking about mental health dollars, because it feels like on the outside that if there's up to $20 million, then everything should be taken care of. Having worked in the community, $20 million is starting to be a remarkably small amount of money. But if we could understand clearly what's covered and then what needs to be supplemented, if there are supplements that need to happen to this within the county, this 20 million up to, I think that would be really helpful for people to understand. And the 25% is only 2.2 million a year once the 75% part of the tax goes away. That's supposed to include the services at the facilities. We could be dangerously close to using that money just in the facilities. So I think understanding what the costs of existing services that aren't reimbursable right now is incredibly important. And also setting aside those different sections of money, because it could just be that 25% is not ever going to be enough. And we are always going to be having to look back and add additional funds. So thank you, Janine, for bringing that up. I appreciate all of your work, and I really hope you get a staff person super soon. Thanks.
Thank you. Moving on to agenda item 3F, discussion and possible action regarding report from the Kemper Report Ad Hoc Committee.
Are we going to vote on? We didn't vote on B.
Was there a motion?
Well, no, there wasn't. You brought it forward. Were you looking for it?
No, I basically was looking for discussion.
Okay,
You know,
all right.
so there was a response to Mr. McGowan.
Okay,
Yes.
thank you.
Agenda item 3F.
What about 3G? We're on 3F. I know. Did we skip 3G?
F comes before G.
Turn your mic off. I didn't.
Oh, I think this is your item, Jen.
Okay, I'll start, Janine, and then you can fix it for me, okay? So, F, Kemper Report. So we met at noon, and unfortunately Donna couldn't be there with us. We didn't get into a whole lot of details, but we did discuss creating a strategic plan. That would be really important, because strategic plans are important for long and short-term goals. And so here we are accumulating all this money without short and long-term goals. But I also wanted to share that I recently went to the CIT International Conference and got a whole bunch of great ideas, and I forgot to bring the report to me to share with you guys. But I spent an hour talking to an officer who essentially started the program in Memphis and created the Memphis model of CIT, which is actually a integrated community program on crisis intervention. And I'm hoping that we'll get him here at some point. I have to do some groundwork. He said it's all about building relationships, and that we have to have relationships with all of the agencies in the county, and we have to work together. And it's about providing service and about providing kindness to the population that is most needy and most overlooked, which are our mentally ill population and their family members, who end up being the default caretakers. So I'm hoping that we will consider looking into a crisis intervention team that is community-based with behavioral health, law enforcement, and advocates within the community, and seeing what we can do to build a consensus and a unity of thought to seeing what we need and how we can work together. Okay, you can fix it now.
So I don't know what I'm fixing, but I'll fix it. So I think we were talking about, we did vote to move forward to talk to the board about a strategic plan, and so I think we still need to decide who is all going to be on the ad hoc committee to move forward with the strategic plan and the percentage, the prudent reserve percentage, which we talked about doing. But part of what we talked about, and I sort of think it kind of goes back to the previous item is what Jan's talking about, is having the crisis intervention team be part of the services that we look at as we look at Measure B, and to roll out that it creates a crisis intervention team. I told Jan that I would love to see it called a community intervention team, because it's more of a community team, so that you have resources in a community in place that if an individual goes into crisis, those community is working together to make sure they don't escalate to the level that they need the higher level of care. And so does that kind of...
Well, and that you know where to direct them?
Correct.
Yeah.
In talking to people, I heard that NAMI already has a crisis intervention team. Is that not true?
That is not correct.
Okay, because we actually had a presentation last time about cahoots as coming here and giving a presentation on crisis intervention, and yeah, that's what I heard, is that we already had that capability.
Our local NAMI does not have that. Oh, sorry. Sorry, our local NAMI at this time does not have that capability.
Yes. Ms. McGuire.
Cahoots was one of the workshop presentations at the workshop that I went to that I did not attend because I was looking at baby steps. So I don't really know what Cahoots is, but this seems, a crisis intervention team seems really basic that would combine all aspects. I wasn't here at the last meeting. My understanding was the Cahoots was by UPD, which would just encompass the city of Ukiah. Is that true? No?
No, actually it was regarding the law enforcement withdrawing from responding to simple calls of contemplating suicide, and rather sending a team comprised of mental health workers.
So when I was talking, when I was talking with Major Sam Cochran this morning, that was one of the things he touched on, was dispatch calls and being able to collect data from dispatch calls and how many were mentally health related and how many were attempted suicide, and taking that data and be able to figure out if people are being sent to the right places. So, but it also determined if there was a mobile outreach team in place to respond to them. So, yeah.
Thank you. Yes, Ms. Ryan.
Yeah, I think I'm just following up on what's already been said, and then you reminded me just now that you weren't at the last meeting, but Cahoots sounds very similar to what you're proposing. It does not have a law enforcement component, and it's a little bit broader than just people who are threatening suicide. It's any mental health issue, behavioral health issue that's not a criminal activity. So it's right now, police are being dispatched to those calls. So-and-so's yelling at cars, and that doesn't need to be a police response. And so Cahoots is specifically usually a medical person, a paramedic of some sort, and also a social worker, someone who can effectively triage that person and get them into a center, get them treated, get them to a caseworker, whatever that client needs. And so that is, it's a model that's out there. It's roughly 30 years old, being used in Eugene, Oregon very successfully. And I have the handouts from the last meeting that I can share with you. But I said at the last meeting, and I'll say it again, I think, and maybe this can wait until we have our project manager, but I'd like to do more investigation into whether this model can be scaled down for a community of our size. Basically, it does require 24-hour dispatch, so it's staffing, essentially. Is there something that we have currently that can be scaled to operate this way? I don't know, but I think it's worth learning more about.
Yes, Ms. McGuire.
So it sounds to me like an integral part of both of these things, especially crisis intervention team, is education. So knowing how to respond properly and de-escalate people verbally, which requires training, which, oh my God, we have the facility for that. Thank you so much.
Sheriff Holman.
I'm sorry if I sound like a broken record, but I think some of what we're talking about, and I fully support Cahoots and I support getting in the community, but it falls within the realm of the Behavioral Health Board and the Department of Mental Health. And if the Behavioral Health Board and the Department of Health came to Measure B and said, we think that some of your service monies should be used for this, then our job is to say, yes, we will go to the Board of Supervisors and support that. But it's not really our job to investigate the most applicable process for mental health service in this county, because that falls with the Department of Mental Health and the Behavioral Health Board. That's exactly what they're supposed to do. So I just want to keep us on track of what I believe our process is of how to spend the monies in the best way possible, and allow these other specialists in mental health and Behavioral Health Board, which has advocates and has mental health clients on it, come to us and present it to us, and then we say, sounds good to us, let's go. So, we meet 2 hours a month, and I support this, but I think the right people to do it would be standing at the podium telling us all about it, instead of having an open conversation. Sorry, thanks.
Did you have your, no, please, Jen.
So I just wanted to mention that Crisis Intervention Team is a three-pronged community group that includes law enforcement, behavioral health, and advocates. And at the conference, most of the attendees were law enforcement. So the Seattle PD was there in uniform. So it's not that this is, I was probably one of the few people that was not law enforcement or behavioral health specialist. So it may sound like it has to do with Behavioral Health Board, but I was just there as an interested party. Mainly it comes from law enforcement. Thank you.
Jen?
Should be. Maybe we should be receiving regular recommendations from behavioral health, mental health. And then maybe this takes us back to the prior item where we discussed a possible need to have a major evaluation done of the existing services. But if our job is not to recommend services, then I think more than a couple of us might be a little confused here.
Sheriff Ullman.
So I am happy to take this back into behavioral health and work with our behavioral health board and have us review it, and then the behavioral health board or myself could come back and just give you guys a recommendation of the different things, since we're looking at mobile options and stuff anyways.
So now I do. So that, thank you, Janine, because that's exactly, the agenda item, Chair, that you brought forward regarding services and having people tell us what their services were needing. Think of that agenda item and think of this agenda item and say, yeah, that would be perfect. If somebody from the Behavioral Health Board came and said at the podium, this is what we would recommend with Department of Mental Health, then we would say, yeah, we've researched it and it sounds good. But it's not our job to research the best item when we have the responsibility of spending the fiduciary responsibility of what we're challenged with. But I appreciate your comments. Thank you.
Mr. Myrtle.
Crisis Intervention Services, is that what we're talking about? No. What is it?
Intervention Team.
Okay.
It's more than...
Okay, Crisis Intervention Team. It'd be helpful to know what that is, because that's the first time that I've heard that acronym. And it sounds like to me, from just my limited perception of what I think it might be, is that some type of law enforcement should be involved in that team, or at least someone that has a connection to law enforcement would be part of that team. And if we knew what that team was and that was a service that we wanted to do, then maybe we could get help from local cities to provide a community service officer to help with that team. So being that specific about what, hey, this could really help, would be helpful for all of us to make informed decisions.
Ms. Muschetti.
So I would like to just say that services is a huge area. I totally agree with a lot of conversation. We as a committee will never be able to go through all that on our own. Reports from behavioral health, reports from the county. As far as CIT, Jan did an excellent report, which I think should be forwarded to this committee for that, and that we do, it's not your fault, I can do it just as easily, and that we can do our homework and read through that. But we're never going to get through all the services. That's why I was saying if we want to give money for services, they have to present us with a plan. They have to give us their info. I don't want to make decisions on things that and I'm an advocate, that I don't have any idea about or don't have the data or don't have that information. And we could spend hours sitting here talking about that. And I would not feel confident doing anything without being knowledgeable. I'm sorry. Thank you.
Are there any public comments? Thank you. Seeing none, I would like to go on to the next agenda item. Discussion and possible action regarding the allocation of no more than $250,000 of Measure B funds for potential improvements to the Regional Behavioral Health Training Facility.
Yes, thank you. I brought that forward. The Behavioral Health Board, and to answer your question, escrow certainly is closed, and we've certainly had an opportunity to look at the building and go through some ideas of how it could best be used for training. And I'm very specifically talking about the behavioral health training facility, and very specifically not talking about the sheriff's substation, because the monies for the substation are not on the table here at all, and I'm not going to be talking about those. So if you look at the total price of the behavioral health regional training facility, the county paid $272,300, the 70% of that, and the sheriff's office paid the remainder of the purchase price. This is one of those which came first, the chicken or the egg, because we need to get several things. The chairs are being removed. The carpet's going to have to be replaced because the chairs were bolted to the floor, and so there's literally 200 holes in the carpet. The roof is fine. The paint is fine. The landscaping is fine. And so what we're looking for is no more than $250,000. And I'm certainly hoping it's going to be much less than that, for the purpose of doing the carpet, of getting the necessary tables and chairs that we're going to be used for the training, the electronics, the signage. We do hope to have some type of kitchen there, so when it's used for a regional training facility, it would be able to have refrigerator and stove and sink and so forth. And to give a little bit more on what I told you about last month, the POST, the Peace Officer Standards and Training, the forced option simulator that POST has offered Mendocino County. We sent 2 training officers to Sacramento on Monday this week, and it's a state of the art, and we expect to take delivery of it for no cost to Mendocino County the second week of December. So I'm asking for a motion, and I'll make the motion if need be, to no more than $250,000, so we can start getting contractors in there and we can see how much it's going to cost to retrofit, with the hope, and this is my hope, that by the second week of January, the Behavioral Health Regional Training Facility in Mendocino County will be up and operating. Thank you.
Any further comment of the committee?
You need that too.
Oh, we got a, oh, that's right, there's a motion. Would someone like to second?
Is there a motion?
Oh,
I'll make a motion. I'll make a motion for what I just said, and the motion would be to ask the Board of Supervisors to obligate up to $250,000 for the purpose of retrofitting the behavioral health regional training facility, upgrade it to being in working operation.
is there a second? Oh, second?
Well,
Can I-
second.
Can I second? I don't know.
You can second it.
yeah, I would-
And then I become chair. Ooh, watch out.
I would like to second it.
So we have a motion and a second on the floor. Do I have any comments from the committee? Jan?
Yes, I'm wondering, when you went over the plans for the remodel, did you include behavioral health, since it's supposed to be behavioral health focused?
Did I include behavioral health because it's supposed to be behavioral health?
Well, you said it's a regional behavioral health training center. Did you include their department in the plans? Was there a committee? That's my question.
We don't have a committee because we're getting to the point where we're going to decide what we need. But before we decide what we need, we certainly have to have an operating budget. to decide what we need. And it's certainly my intention to work with behavioral health, mental health, and to go over the plans and see if they have ideas, additions, but it's going to be an academic and a physical training facility.
So could we include that in the motion?
Sure.
That there would be cooperative planning?
So I will amend my own motion to say that this could be an ad hoc committee that will include Director Miller from the Department of Mental Health to work with us.
Mark?
Hold on.
Oh.
Hold, please. Does the seconder of the motion agree with the amendment?
Seconder agrees.
Mark?
So I'd like to see an outline of what the $250,000 is going to be spent on. Just a general outline of, you said carpet, construction, design services, painting. That would be something that I would like to see prior to approving the money.
Jed?
Yeah, my just question, Sheriff, is similar. I think training is one of the most important things that we may be approving and will, I think, have a very positive effect on all the issues that we're addressing now and in the future. So I'd like to hear a little more about what this would entail, and I'm not sure 250,000 is too low, or, you know, I wonder what all it covers, because I'd like to know what the needs are to really get a really high quality operating training facility up and running as soon as possible, because I think that can be really helpful.
Sheriff?
I'd be happy to address that now. So as during the tour that most of us took, we saw that the former church itself is structurally a very sound church with ADA, complete ADA male and female bathrooms. We saw that the roof was good, the landscaping is low maintenance, low water. So what we're looking at is things on the inside. So certainly very sturdy tables and chairs, and they'd have to have the roll-up things to get them out of the way when we start doing the physical training, where law enforcement of the shoot, don't shoot, when you're actually, you have a wrestling mat there and you may have to go to the ground during training. We're looking for very technical digital displays and the projector, but this church is already wired for that. They're wired with the sound, it's wired with the electronics wires going to the back of the room. As I said, we'd like to do some type of kitchen in there. It does have plumbing because of the ADA bathrooms, but it doesn't have anything outside of that. We're looking at signage it's going to be a regional training facility. We certainly want to, it's right there at the corner of East Road and Road C. Put County of Mendocino regional training, behavioral health training facility there. And that's it. So I would welcome an opportunity for us to go out there again and discuss it. We've spent quite a bit of time out there of looking at it and saying what would be the best use of this room for a good, conducive training facility. And POST, once again, Peace Officer Standard and Training, offers experts to come in and review once we get everything ready, and I don't have somebody to go out there, and I don't have the staffing to have someone go out there and do the drawing the building, and this is what we're going to do. And I'm not saying that we need to spend a lot of money on that, but this is going to, if we want to make the training center the best in the state, and it'll be the best behavioral health regional training center in the state, I assure you that, because it'll be the only behavioral health training facility in the state. However, I don't want to take shortcuts to where in 10 years or even in 2 years we say, why didn't we do this or why didn't we do that?
Yeah, just certain things I think most of us can picture. We got a general idea of taking up carpet, putting in seats and so on. The thing that seems to me to would be most valuable and is wired for is state-of-the-art equipment to be able to do teaching. And I presume that's projectors and that's a certain amount of computer facility or microphones. I'm looking at our next item where we're talking about approving money for being able to have some kind of facility for talking and being able to hear audience. I presume those kinds of things would be also part of what you're anticipating, but I just wonder, have you figured the costs in for those kind of things in the $250,000 up to, or whether that's included or not? That's my question.
As I said, this is one of those chicken and egg things, which came first.
Right.
And so what I would welcome is an opportunity to have this committee approve this and have on the agenda for next month the layout, the schematics of where we're doing, and the notes from the meeting with the Department of Mental Health Director, and saying this, we're moving forward. I'm really and truly, to be blunt, I'm trying to get something going. And,
I get that.
And bureaucracy is very good at you know, if a committee of 3 can design a horse with 3 humps, and I'm not looking for that. I'm looking to move forward, but not rush it, but keep you informed of what we need. But we're not going to be purchasing equipment which is extraordinary. I think high quality materials that's going to, where we can predict in the future we're going to use it, is where we're looking for. And I'm hoping that we can get training. Training is very important. You know, the liability for Mendocino County, and not just Mendocino County, but the local law enforcement agencies with mental health is extreme. And the sooner we start doing the training, really and truly, the sooner we're going to start reducing liability. And more importantly than reducing liability, the sooner we're going to be able to deliver better services to victims of mental health. Thank you.
Madam Chair, if I may, I could use a little bit of clarification as to the motion and the amendment. Is it all right if I?
Certainly.
So I understood that the motion was to make a recommendation to the board to commit up to $250,000 of the money, but there was a reference to the ad hoc being created as the amendment, and I wasn't quite clear of the role of the ad hoc. Is the intent that the ad hoc is going to be coming back to this board with recommendations for a specific plan as to the expenditure of the money, or is there, I'm not quite clear if the intent is to recommend approval of the funds to the board now, or to come back with a plan first to then provide to the Board of Supervisors, and specifically what the role of the ad hoc would be.
Thank you, County Council, for keeping us on track.
It would be my intent that the ad hoc would report out to this committee next month, but also prepare the paperwork for the Board of Supervisors for the expenditures of very specific items, and be able to go out to the request for proposal for the public project, carpet lane, and any, I don't think there's any structural things in there. Public project, as you know better than me, Christian, is we certainly have to have our ducks in a row before we go out to RFP. And I'm trying to get the funds available so we can go out to RFP, and then when we go to the board, we can say, yes, we've taken care of that. So does that answer your question?
I think in part, I just want to be clear as to, so generally speaking, ad hoc by itself would not have the authority to be making specific determination as to the expenditure. So, and as I understand it, the intent is for it to come back to this body for a proposal with some more details as to the specifics of how the funds would be prepared. So I guess my question is the intent of the motion that this body would hear the plan at the next agenda before submission to the Board of Supervisors, or is that there going to be both a submission to the Board of Supervisors with a request for the $250 and then a separate consideration within the advice of the ad hoc as to the specifics of the expenditures?
I was certainly hoping to move faster than that, but if our attorney is telling us that we have to wait 4 weeks to say this is what we recommend to the board, I honestly think that the $250,000 is a reasonable amount for you to trust an ad hoc committee to look at expenditures, and certainly you would be briefed on it, but it wouldn't delay the progress of moving forward. But my motion's on the table, and I have a second, and if the motion fails, then we'll let someone else take care of the motion. Thank you, Council.
Jan? Oh, sorry, Mark.
Okay. But yeah, I would be much more comfortable if we established an ad hoc and made recommendations and then came back with a budget, because just a lump sum of $250 without exactly saying where it's going to go makes me nervous.
Member Myrtle?
I would hate for us to authorize this money and then realize there's not enough money and we have to come back to the board and ask for more money on a request that we said we weren't going to exceed $250,000. Things that come to mind in construction are fire sprinklers, fire alarm system, site work to support those things. Those are things that may be required, may not be required, but those are things that weren't considered. So I think that maybe $25,000 to go through and maybe hire some professional services to design what you're going to do might be a little more prudent. It's 10% of what you plan on spending. Or were you planning on not getting any of the hiring of professional services to do that? Are you just going in and repairing things, or were you designing new operational facilities?
There's no repair, there's no redesign. It's merely putting carpet down, putting electronics in, getting tables and chairs, getting a wrestling mat, and working with a kitchen. And the kitchen may require some additional equipment, but I think that that would allow us, if we could move forward, the kitchen could be the part that we could stall if it's going to cost more money. But does that answer your question? Thank you.
Jan?
I'm still reluctant. I would rather see the motion be to establish an ad hoc committee to bring a plan forward, because I would like to see other people involved in the consultation. Then I'm afraid that behavioral health might be left out if we just, say, here's all this money and go get some new carpet. When, I've built houses and remodeled houses, and I know how to make a floor plan, and it's really tricky on where you put the kitchen. And if we're talking about this special equipment that you're getting in January, what does that look like? How much space does it take up? We need to look at the floor plan of things like that. I think it would be good to have a committee to look into that.
My only comment is I'm afraid that, as with the Kemper report, that if we don't have a plan, the Board of Supervisors is going to say, you need to provide us with something. I don't know that they will do that. I also feel that if we need 300,000, we need 300,000, and we say there's going to be no more than 250, and I don't want to strangle us with that. And that's just my opinion. But as far as I would like to see the training center get up and going, I think it's going to be wonderful. NAMI will love to take advantage of it. But as the sheriff says, we want to do it right. We want to do it correctly. And I don't want the Board of Supervisors to send this back to us asking for more. And I also, if we need 300,000, I want to say, let's get 300,000. So that's just my comment. Any other comments? Sheriff? Anything? Mark? Any members of the public like to comment, please?
Joe Bradley, Little River. We were looking at a house and doing a remodel, and we were quoted about $300 a square foot. And you're talking a kitchen, and you probably have to make it a commercial kitchen. That would be my concern. And were there sprinkler systems already in that building? Tom, I'm sorry.
There's not. We had a whole meeting on that where our building and planning consultant said it wasn't mandatory. So we could have another whole meeting on it, Joe. But
No,
we've been
I just
told that we
didn't
don't
know.
need to have sprinklers unless it's been, the rooms have been remodeled and so forth, and that's not the case.
Okay, so then I don't understand why we couldn't allocate, let's say, $300,000 instead of $250 as a budget for doing all the work. And that way, the ad hoc committee knows they have a budget of $300,000. We have to get this done within that purview. And if something out of the ordinary comes up that hasn't been foreseen, then that can be attended to. But giving somebody a budget to do the work doesn't seem out of line to me to get it going. And maybe the 50,000 extra for the 300, and because if we don't use all of it, then it goes back into the building. But the kitchen would have to be commercial, and carpet has to come up because you've got trip hazards, and it sounds like the bathrooms are, if everything's ADA and the roof is good and everything else, I think we're worrying a little. I would rather spend the money on getting the people in there to train the people. Tables and chairs, mats, the electronics, the wiring's there, so you just have to get something compatible to add to it. So I would say up the ante another 50,000 and give somebody a budget and let them run, in my opinion. Thank you.
Any further public comment?
Maya Stewart, Adventist Health. It seems like you all have a ton of work to do, and you already are wondering how to figure out how to get proposals for services and do needs assessments and things like that. If it's difficult to find the time to do those things, it seems like a lot to ask a whole new group of people to come in and do research that has already been done. I think I would feel good as a taxpayer and a voter knowing that an up to amount was agreed, that whatever you decide, 250, 300, but understanding again that is an up to amount. And at the same time, an ad hoc committee could join the sheriff and Ms. Miller to take a look and make sure that nothing is being forgotten. But I do think we have to trust our partners, and we talk about partnering a lot and being collaborative, and what ends up stopping us is that we just don't trust each other, and sometimes we just have to move forward with the army that we've got. So I recommend, as a member of the public, that we move forward on this so that we can get some training, which we all know is important, accept or approve the sheriff's request, and then accept or approve maybe an ad hoc committee or some kind of formalization so that you feel comfortable that at the next meeting there will be more heads that have joined there and understand the specifics of what the needs are.
Thank you. Any other further comment from the committee? From the public? Cass, could I please ask that the motion be read in its entirety?
Motion to request the Board of Supervisors allocate up to $250,000 of Measure B funds for improvements to the Regional Behavioral Health Training Facility and create an ad hoc committee to include Member Miller to report back to the Measure B committee at the next meeting regarding the improvement plans and prepare the report to the Board of Supervisors for approval of expenditures.
Could I ask for a clarification from County Council? So as I hear the motion and as I understand the motion, no funds can be expended until the ad hoc committee comes back to us?
Well, this is the part I wasn't quite clear on. I think the sheriff's intent was that the funds could be expended, but that the ad hoc committee would be reporting back as to the way that they were expended at a future meeting without it going through additional review. But I don't want to speak for him. I think that's what I understood his intent to be, but I do think that it would benefit from just a little bit of clarity on that point.
Sheriff, do you mind?
Sure, but if this committee would approve this and with the condition that it doesn't go in front of the Board of Supervisors until after this committee reviewed it, I'd be very happy with that clarification in the motion.
Thank you, Sheriff. Hold on. I know the rules, sort of. Are you happy with that clarification, the seconder?
Yes, I'm happy with that clarification.
Are we legal with that, County Council?
I believe so. I would just ask if it could be read back so that we're all clear as to what it was with clarification.
Please.
Can I please request that you repeat the clarification?
Yes. Clarification is that the ad hoc committee will report back to the Measure B Oversight Committee prior to submitting the agenda item for the Board of Supervisors approval.
Okay. Reread it.
Just a minute, let me make sure I have it right. We also need to clarify that there are 2 members of the ad hoc committee, and that would include the sheriff and Member Miller.
Yes.
Yeah, this is Carmel. Could I ask for further clarification on that motion, please?
Yes.
So if I understand the motion, you're saying that the ad hoc will be formed and the ad hoc will develop a plan and a budget, and that will come back to Measure B. And then if Measure B approves, then that would be sent to the board as a recommendation, and then the work would start on the training center. What I don't understand is, can we start the work on the training center now, or do we have to wait until the committee comes back and Measure B approves that, and then it goes to the board?
I'll answer that, and certainly with the intent of this committee, Carmel, no work will be started until after the Board of Supervisors has approved the expenditure.
Could I just comment on that? I mean, I really support the sheriff with this, and I also believe in the fiduciary responsibility, as the sheriff has said, of this committee. Given the amount of time it does take to get projects done, one is those of you that are fire victims understand that there aren't contractors just sitting out there to do work. At least if we were able to start, if there was any wiring that needed done in that building, and again, this is in support of what the sheriff is trying to do. Even if there was a way that we could start with if there's any wiring that needs done, anything, things that we know absolutely are going to need done, not those extras or something that would actually be designed, but things that we know are actually infrastructure that needs done. If there was a way to have this committee recommend that we could move forward with those renovations, I think that would be helpful. And that's all I have to say. Again, I support the sheriff. I also support the committee's fiduciary responsibility. I sit on it, so that's all. Thank you.
Any further comment? I would like to say that I also agree and understand that there are certain things that I think could be started. We're going to expend money for the training center, and County Council would have to let me know if this is possible. What we're talking about is an expenditure of a huge amount of money. We want a plan. We want that. And not being a private citizen, I don't understand government completely. I don't see any reason why he can't start certain things that are small without us having to approve that. But for the big things, for the total 250, we'd like a plan. We'd like that kind of thing. Are we completely out of bounds with what we're doing?
No, Madam Chair. I would say you certainly can do that. The only question is really if there needs to be, on that front, two recommendations made to the board. I know that the chair had indicated that you'd like to avoid going back. If there's a belief that there would need to be authorization for funding to start work now, you could certainly make that recommendation with the understanding that a more thorough plan is being developed by an ad hoc to be approved by this committee.
I also personally believe that the Board of Supervisors would go along with that. So we do have a motion right now on the floor that needs to be acted on. And then if we so choose, we can make a second one to actually recommend to the Board of Supervisors this next coming meeting. So please read. Sorry.
Chair, I'm sorry, I have to jump in here on county process. This is Carmel again.
Yes.
As of today, there is no Measure B funds allocated. So if you recall what happened with the Kemper report, where there was an additional $24,000 to pay Kemper, and as CEO, I brought it to the board, and the board would not approve that because the Measure B committee didn't make the recommendation. So all I'm saying is that it would be good. This is a tough one here. We've been going back and forth on this for a while, but there has to be a recommendation to the board to spend X amount of dollars.
Correct.
And so if that motion is amended to say recommend to spend X amount to begin the infrastructure revisions or whatever, with the understanding that a plan and a spending plan would then come forward from the overall Measure B committee in the future. I mean, right now we don't have authority to spend one dime on that building. So the sheriff, in my opinion, if he's frustrated, he can't even move a chair. He can't even have a chair removed in that building. So there's got to be some recommendation for board authority to spend some of this money.
Correct, and I totally agree. So I'm going to try to keep this as clean as possible. County Council, and I will ask the sheriff how much he thinks for startup. If the sheriff were to amend his motion to state, for example, $50,000 right this minute for startup, $200,000 to be incorporated in a plan, it's a clean motion.
Yes, Madam Chair.
I don't know if you like those figures, Sheriff.
To the committee, I just want to get something started. And it's while I understand the need to cross our T's and dot our I's, the big picture is improving the quality of mental health in this county. I'll take any motion that allows me to get started. Very, very simply. I welcome an input from behavioral health for this and us have meetings, but the bottom line, it's not rocket science to develop a training center. And we spent 20 minutes on this, which is certainly a sixth of our monthly meeting. And I would welcome an opportunity that we can move forward. You have my word, no one on this committee would be disappointed in the progress that the behavioral health director and I will recommend to you.
Any other further comment? As far as I'm concerned, Sheriff, I'd like to see you get started. I also would like to see a plan. I'm, conservative, can't help it. So would you be happy with startup funds and then the other amount?
I would be happy with the motion that you asked county council with and he approved of. The amendment to the motion.
Perfect. Thank you, Sheriff. Do I have a second on that?
I agree.
Do I have any further comment?
Just that the motion be read again, please.
Yeah, absolutely. I'm on that. Cass, please.
Motion to request the Board of Supervisors allocate up to $50,000 to begin improvements to the Regional Behavioral Health Training Facility and create an ad hoc committee to include Sheriff Allman and Member Miller to report back to the Measure B committee regarding the improvement plans.
Is that a good motion?
Yes, Madam Chair. Just one clarification. I thought I heard that the the intent of the motion was to have the ad hoc essentially propose a plan for an additional 200,000 worth of improvements.
Right, that is in there, correct? So it's 250 total, correct, Cass? Eventually.
I'll need to clarify that.
Now I know why Senate hearings take so long. No.
Okay. The motion to request the Board of Supervisors allocate up to $50,000 to begin improvements to the Regional Behavioral Health Training Facility with an additional amount up to $200,000 for a total of $250,000, and create an ad hoc committee to include Sheriff Allman and Member Miller to report back to the Measure B committee regarding the improvement plans.
Yeah. Okay, roll call, please. With other expenditures, yeah. Roll call, please.
Chair Barish,
Yes.
Vice Chair Muschetti,
Yes.
Sheriff Allman,
Yes.
Member McGorty,
Let me think about it.
Member Miller,
Yes.
Member Riley,
Yes.
Member Myrtle,
Yes.
Member Diamond,
Yes.
Member Angelo.
Yes.
Okay.
Thank you.
Motion carried. Thank you, Sheriff. Thank everybody for their everything. And now I am no longer chair.
Can I please see how Member McGorty's vote was cast? She said, let me think about it, and that's not an aye, no, or abstention, please.
Oh, you're very correct, Sheriff. Thank you.
Yeah, I vote yes.
So it passed unanimously.
Moving on to agenda item 3H, discussion and possible direction regarding the use of Measure B funds to acquire a sound system to be used for the Mental Health Treatment Act Citizens Oversight Committee meetings.
Good afternoon, Janelle Rao, Deputy CEO. This committee typically meets in a county conference room, but as it's a public meeting, it does need to be ADA accessible. You will recall that there are some issues within some of within the room, which was conference room C, as it doesn't have an equipped sound system. For this particular meeting, we moved it to our board chambers because it is ADA accessible, has a sound system, it's equipped. This room is not available on a recurring basis, nor is it situated for your total meeting body. So we did prepare some options for this, for your body to consider as far as allocating funding to acquire a system, which is a wireless system that could be used in any particular facility. This would allow the committee to then meet in any particular facility. That would also allow you as a committee to live stream your meetings, such as we're doing at this point in time. Currently, we have county staff that are allocated. You'll see sitting in the back of the room here, Scott, who is from our IS division, who attends these meetings. He attends these meetings and records them. At present, because there is no audio quality, he spends a great deal of time in their hours actually in editing these videos to make them actually of a public quality. Because there's no sound, the quality is very poor, so he has to do a lot of editing and enhancing on that currently. I would also like to note that at this time, the county is not charging Measure B for those services. So I just state that to be clear. So from the county's perspective, we are providing that service. We will continue to provide that service. It's our position that actually investing in this equipment would better suit this committee for the long term in your meeting, and would also allow you to meet remotely at alternative locations, let's just say on the coast or in any other facility of that nature. There are other options. There are wired options, but again, that's setup and takeout time. If in fact we were to do that, we would need to either hire individuals to do that setup and takedown. You would also be able to look at other meeting rooms that may be ADA accessible, that might have sound, but you would likely have a cost associated with that. So we just wanted to present that to this committee for you to discuss and to determine what you prefer as far as your ongoing and recurring meeting accommodations.
I'm sure you have this, but do you have a cost associated with
In your packet?
in my packet that I didn't look at?
Correct.
Of
In
all-
your
And I don't
packet-
expect all the options, but a couple
Correct.
options? Yeah.
In your packet, there are a few options. The wireless option, which allows you to, and it would accommodate up to approximately 14 participants. That would be a wireless, that meaning you come in, you set it up, you're good to go, and that could be anywhere. And by wireless, and why that's important is in order for you to have a public meeting, if you have wires, they have to be put in a way that they're not trip hazards, and that there's various requirements for that. So the setup and takedown is quite cumbersome, and it also limits your ability in how you seat, and also ensuring that you have adequate sound for the public to speak as well, such as I am at this podium. So the cost up to approximately $35,000 for a fully equipped system. You could go anywhere between $15,000 to $20,000 based upon our research for a wired system. I am not certain that our conference room C would be appropriate for that. We may need to look at an alternative space. That space right now is fairly restricted, as you know, if you have members of the public attending, there's not a lot of space. So those are some options for you. There are other space available throughout the county. Most of them do come with a cost. Once you have some staff on that can do some further research, you could look at what those costs will be and maybe what those alternatives are. But that's what we presented to you right now. You do have to have some form of space for your next meeting that is ADA accessible. Board Chambers is not available.
Can I assume that I'm looking at Scott here, can I assume that the wireless system that we're talking about would be put into a container and stored until the next meeting, and we wouldn't have to worry about it being used for other meetings and breaking and so forth?
Correct. I can confirm with Scott. This is a portable system that would have carrying cases, bags, and a cart. It would be secured. It would be locked. We would protect it to ensure that it was that the integrity of the end system was safe for the Measure B committee.
Jan?
So the Behavioral Health Advisory Board meets monthly, and every other month we teleconference with Fort Bragg, and we had a horrible experience with our sound. So recently, a big new sound system was purchased with professional advisement. So I'm wondering why this couldn't be shared with this meeting. Hopefully, in the future, it'll be held at the training center where we won't need additional sound. Because I hate to see spending $35,000, $40,000 of Measure B funds on a sound system that could be, shared.
Without knowing what system you may be referring to, I'm looking at Janine to see if she could add to that. You do have to have something by your next meeting. So, I'm talking about this committee. So are you suggesting there's an alternative location that this committee could use that would situate 14 members? This committee?
Are you talking about location or a sound system?
Both.
Well, a location would have to be investigated. The sound system is here.
So we do have a portable sound system that was purchased to allow for trainings, for behavioral health trainings, and for allow our Behavioral Health Board to do off-site meetings and be able to communicate between the two locations as we do. I don't know the compatibility of that and how it would work with our large group. Because we haven't done it that way. I do not think it would allow live streaming, obviously, because that's not a piece we added to that equipment. So I want to clarify that. So I don't want to sit here, I'm not the tech expert to say it would be perfect, because I don't know that. It works for what we use it for, and that is for the Behavioral Health Advisory Board to be split in two locations and to use it to be able to communicate.
And again, I couldn't speak to the portability of it either, not knowing what it is. You are a large meeting body with multiple speaking microphones. As you can see from here, this sound system is equipped to pick up the voice and the carry without any type of interruption or feedback. But it's entirely up to this committee. At this point, there is no identified meeting location that is ADA accessible for your next meeting.
Jed, did you have a comment?
Yeah, I wasn't sure. We've been meeting in a room for 2 years or almost. Are you saying that room is not ADA accessible and we need to meet in a different room?
Correct.
Okay. So that's one issue, if I'm hearing right. One issue is the room we've been meeting in is not ADA accessible and we need to find another room. This room is not generally available.
Correct.
Okay, so that's one issue. The other issue that we're talking about is having some kind of a sound system where we can hear each other and the audience and community can hear everybody, and the recording that gets done, that gets saved and broadcast needs to be of quality enough that where it gets broadcast can be heard.
Correct.
Right? So those are all important issues, and they're in a way separate. ADA, where you can meet, is a little separate issue from the sound system issue. Am I right?
Not entirely, because sound is part of your public requirement when you conduct a meeting. So if you have a member of your public that can't hear you when you're speaking as a public body, you run into an accommodation issue.
But are you saying, though, that the meeting room where we were meeting, beyond the sound problem, is not ADA compatible, or?
I'm only speaking to sound.
Just sound. Okay, so it's only the sound part of the.
Correct.
Okay,
Correct.
gotcha. And then just a question I had is, I presume there's a lot of other meetings that have the same problem, other kinds of meetings that go on, like behavioral board, that have the same issue that the Measure B committee has.
I can't speak to that. I just know that for this particular meeting body, there was an issue regarding the sound and the ability to be able to hear that public meeting body during a publicly held meeting.
Okay.
I don't know that we've had that. I don't know exactly where each one of our boards, committees, or commissions meet. They may have a portable sound PA system. Those portable sound PA systems are not situated for members such as 14 of you or 11 or however many are participating. We were accommodating up to 14, which included council and staff and the public.
Mr.
Mark?
What's the life of the system you're providing?
I would look at, from an IT perspective, typically 10 years. 5 to 10 years. Cody is our IT division manager in the back of the room, which he and Scott, who is more of our sound and video specialist, put together the specifications, did some research. 5 to 10 years, I would say 5, but the type of technology we're talking about doesn't change or alter often from a video and sound perspective. So if it's well maintained, 10 years would be safe.
Mr. Chair, if I may, I just want to make sure that, I think Ms. Rao touched on this, but I just want to make sure that one point is very clear, which is that the room itself is not failing to meet ADA accessibility standards for the purposes of door width, wheelchair access, those sorts of things. I believe Ms. Rao is simply indicating that we've had some issues in terms of the ability of the public to hear in that location, and specifically that there may be people who, I don't know if they've actually requested accommodation, but may have indicated that due to hearing disability or limited hearing, they may have had trouble understanding and accessing the information at the meeting. There is more than one way to accommodate that. I believe that this is simply the recommendation of staff as to the most effective way to provide that accommodation.
Shannon?
I appreciate that the county has been supporting this committee to date with the IT services. That's a tremendous help. I also really appreciate behavioral health's offer to see if their equipment might be useful. I would like to investigate that offer over the course of the next month, and if for some reason it's not a system that is compatible with the conference room that we've been using, then I would recommend that we take this up again at the next meeting, and I would implore all of my colleagues to use their best projecting voices at our next meeting if for some reason the system is not available. But I think, as a steward of the taxpayers' money, I think we have an offer of a system that might work. And I think it's our responsibility to see if that would work before we spend $35,000 of mental health money.
Ms. Muschetti.
I just wanted to state, and if I understand correctly, which again, government, I don't, this committee is going to be in existence till the taxpayers vote us out, right? Because we still have services after the 5 years.
Correct.
So this committee is going to be in existence most likely for eternity. And that maybe not these people, I hope, but it's going to be in existence for eternity, so that, or until the taxpayers vote the tax down. So I just want people to think about that. This is going to be a forever board, or committee, excuse me.
Any further comments in the public? Seeing none.
Mr. Chair, if I may, I just would like to add, in the event that the committee does not elect to recommend the adoption of the sound system, the county does have an ADA coordinator, and I would just, for the benefit of the public, if anyone is looking to attend a meeting at which the sound system might not be in place, please do contact the county's ADA coordinator to make appropriate accommodations.
Thank you.
If I might, I would discourage meeting in a room, again, that doesn't have the sound capability. That's from a county's perspective, I don't believe that would be in the best interest of the committee or the county.
Yes, Mr. Murray.
Does the county have an assisted listening system?
We do in our board chambers, correct.
So it's this wired system?
We have separate
separate
systems that work with our sound system, correct.
So it's integral to this room?
Correct.
One other comment, just for kicks and giggles. We have $69,570 of interest paid to Measure B, which doesn't include this month's report. FYI, I'm not making the motion.
Is there,
I will make the motion that we go with option A, that we understand that we have meetings to run, and so does behavioral health. And it would be good to know that we each have a backup system in case something goes wrong. But I think that the ADA, and for those of you who were at last month's meeting, we know that there were several citizens who were very irate that they couldn't hear us. And I do not want to participate in a meeting where citizens cannot hear how we are using their tax dollars. So yes, $35,000 is a lot of money. I think that we've had a very good professional look at it, and I think that would be up to $35,000. My motion is that we go to option A, and it's up to $35,000, but encourage the purchaser to get us the best deal, where we'd be very, very happy to hear that you saved us $10,000. But that's my motion.
I second the motion.
is there any discussion further on this item? Hearing none, all of those in favor of? Oh, that's right.
Chair Barish,
Yes.
Vice Chair Muschetti,
Yes.
Sheriff Allman,
Yes.
Member McGorty,
No.
Member Miller,
Yes.
Member Riley,
No.
Member Myrtle,
Yes.
Member Diamond,
Yes.
Member Angelo.
Yes.
The motion carries with Member McGorty and Member Riley dissenting.
Moving on to agenda item 3I, discussion and possible action regarding the allocation of no more than $30,000 of Measure B funds for grant writers. This was brought up last meeting by Mr. Myrtle, recommendation made, and I would like to see this carried. Is there any discussion? I brought this, yes.
All right. So I had a question. So how would funds be tracked, allocated, applied for, administered? How would we do that with the 30,000, and where did the 30,000 come from?
30,000 is conceived of as the salary for a grant writer that would then,
So we'd have a full-time grant writer?
well, I don't think 30,000 would pay for full-time, but a grant writer.
So when my vision of asking where there was existing grant writers that they could write or work towards grants that they would bring to the table that we would allocate funds for, or give a lot sum that could be billed against, for lack of a better word. But not hiring a dedicated writer to look for funds that work in coordination with Measure B.
I don't think there are any grant writers assigned to this committee. I don't know if we just want to use existing county grant writers. I don't know that we can do that, but.
Well, I mean, they know the grants that are out there and if they needed to put resources that would benefit Measure B, I think they should bring it to the table and we authorize it. But I wanted to make that conversation available and to put funds available to support those services, but not hire a dedicated grant writer.
Carmel, do you have any comment?
Sure. This is Carmel. The way that we usually do our work with our grant writers, there are departments that have grant writers and they have separate contracts. They're usually small contracts. I think the 30,000 is, within line of some of the contracts we have, which are approximately 25,000 for a grant writer. What could happen in this case, given what Mark is requesting, would be that if we have a grant writer that identifies a possibility of funding for mental health that Measure B dollars could be matched, then they would go ahead and notify, and in this case I'm just going to say mental health. For instance, they'd notify mental health would say go ahead and write the grant for us. The issue that comes up is the same issue we've been dealing with all meeting, which is that the Measure B committee would have to recommend to the board to spend X amount of Measure B funds, or, I mean, you can say up to 30,000, you can say whatever you want, but there's no authority from the board to spend Measure B money unless the Measure B committee makes the recommendation. So, how you might want to do this is make a recommendation to the board that up to 30,000 or whatever you want to say of Measure B funds be utilized to pay for the actual time of a grant writer to either research or not research, or just research and write, or just write the grant. So all I'm saying is that right now, if we had someone out there, if we had a grant writer in mental health that worked for mental health that was going to write a grant, they would do that, and that would be mental health dollars or general fund. There's no authority to use Measure B. So I think that if the Measure B committee, which I think is a good idea that Member Myrtle has, that we look for matching funds, that there has to be some allocation from the Measure B committee, some recommendation for an allocation to go to the board. So I realize that's a long answer, but you have to take some action here, please.
Ms. McGordy.
Somebody turn my thing on. So my understanding is, especially in rural communities, we're really dependent upon grants to provide financial assistance that maybe LA doesn't have to. And you need somebody to look for them, and lots of times when you find them, you don't have a lot of money to wait for 2 months to get approval from the Board of Supervisors to go forward. So it would be good to have a professional on the lookout for that. I think, having money there ready to go For example, there was a grant that came across from the county and state government things that talked about a grant for stepping up that I forwarded to people, and it was applied for, and they received it yesterday. We just got notice of this $300,000 grant. But, you know, I'm just a meddler. Most people don't sit around looking for stuff like that. So it'd be good to have somebody ready to go to find the grants to provide money to help our county. Thank you.
I'm in total agreement with that. I was just thinking how the administration would work. How do you access the money? Does a grant writer just decide this has something to do with Measure B and they start billing money against it? That's where I'm having a hard understanding, is if we allocate that money for grant writers, then who's going to administer what's Measure B and what's not?
Chair Barris, could I jump in?
Please.
So if the Measure B committee decided to allocate $10,000, $20,000, $30,000, whatever, up to X amount of dollars, that money would stay right in the Measure B budget unit. Of course, this would go to the board as a recommendation that up to $30,000 be used to pay for a grant writer, whatever. And then I would say that the Measure B committee would then also have to give the authority to the mental health department. So you would give the authority to either Janine Miller or Tammy Moss Chandler that if a grant came up and they were notified by the grant writer and it seemed appropriate for Measure B match, that they would go ahead and have the authority from the committee to move forward. But one, we would never just depend on a grant writer to make those decisions. We have had good experiences and not so good experiences in the past. So somebody has to be accountable, and I would think that would be mental health. And so it could be very simple. You make the recommendation, the board approved allocation of X amount of dollars, and Janine Miller is authorized that as she works with grant writers, if there is a possibility out there, that she has the authority to say yay or nay, and that she comes back and reports back to the Measure B committee.
Jan, did you have another comment? No.
Does that make sense?
Yes, Jed.
I think it's a good idea to have the potential to get grants, and I think the intent was to leverage the money that we do have that's coming from a tax measure to increase the reach and the benefits that would be. My only concern is it feels like today, as it's coming up, it's just a little premature, and that we're still trying to get a project manager on, and we're looking at some of these big projects. Seems to me we'd be in a better position to make a recommendation once that part of our work is in place and we have a better idea of where the holes are or what we're looking for by way of, leveraging our money. So I think it's a good idea. It just seems premature today.
I think Camille sent out an announcement of a CHAFA grant that's available now for $750,000 for providing facilities that might deviate people that would otherwise go to jail, for example.
Chair Barris, may I make a comment?
Please.
There is a considerable amount of in-kind services going to Measure B, and rightly so. There is no complaints from myself, county staff, or the board about the amount of in-kind services going to Measure B. But if we are using a grant writer that's on contract, we couldn't expect really a grant writer to do the same thing that the county staff does. I think that at this point that allocating money is, I don't think it's premature, because every day if a grant comes up, we wouldn't want to miss that opportunity. So, at this point, we have no authority to spend this money either as a match or to pay for a grant writer. And if the committee doesn't want to do that, then, in total, you don't want to do that. But it makes sense to me. I support Member Myrtle's motion here that the Measure B committee allocate, $15,000 if you think $30,000 is too much, but that be utilized, for grant writing purposes for our services. Thank you.
All right, I'd like to make a motion
Please.
for spending up to $30,000 of Measure B funds for grant writers to promote or enhance Measure B funding and programs.
Is there a second? There's a motion and a second. Any further discussion?
Did someone second the motion?
Yes, Jan McGordy.
Thank you.
Shannon, please.
Is the intention of the motion to have Director Miller provide direction on that? Who's directing the grant writer, I guess, is my question.
So I believe the way I understood, the grant writer would be, grants that were brought to the table would be authorized by Measure B. Is that the way it's explained, Carmel?
Measure B, yes and no. And what I mean by that is that sometimes we hear about, and I think Jan just talked about this, sometimes we hear about a grant opportunity and we have a week to respond. So based on the timing of the Measure B committee, if the Measure B committee would authorize the mental health director to move forward with a grant, if there wasn't time to get to the Measure B committee, that would be the best approach. But yes, the Measure B committee is the ultimate authority here in authorizing that we move forward with a particular grant. But if you understand the timing with these grants, it could be a missed opportunity if we don't authorize Janine to move forward when the Measure B committee isn't available to meet.
I'd like
The other option is you form an ad hoc. But again, you form an ad hoc of two people, you still have to have both of them available. So it makes sense to me to give the authority to the mental health director.
I mean, if we earmark it for mental health only, what if the sheriff has something that will help promote the PUF unit? What if there's a program that has that? If we earmark it so specific to just mental health, then we might miss out on other grants.
If I may,
Yeah.
if that was the
Well,
situation, I would go to mental health and say, can you help me with this? So,
All right. So
yeah.
I can requalify that to say the mental health director would be administering or be responsible for the authorization of the grant money.
Is that acceptable to the second?
What's
Oh, yeah.
just one, one or the other? Yeah. Yeah. Janine, I would say the mental health director. Yep.
Any further comment? Any public comment on this? Okay, having a motion and a second, I guess we do another roll call.
You have to reread it, huh?
Yes.
Motion that the Measure B committee recommend to the Board of Supervisors to authorize the allocation of up to $30,000 of Measure B funds for grant writers and authorize the mental health director to administer the authorization of the grants.
Perfect.
Want to do a roll call?
Chair Barish,
Yes.
Vice Chair Muschetti,
Yes.
Sheriff Allman,
Aye.
Member McGordy,
Yes.
Member Miller,
Yes.
Member Riley, Member Myrtle,
Yes.
Member Diamond,
Yes, I'm convinced.
Member Angelo,
Yes.
The motion passes unanimously.
Moving on to agenda item 4A, committee member reports regarding items of general interest. Can we start with Shannon?
I have nothing to report.
Jed?
Nothing to report on mine.
Nothing to report.
I also went on a tour of the CSU unit in Grass Valley in Nevada County with Supervisor Williams and Tammy Moss-Chandler and Sergio Fuentes, who's on my board. And I'm preparing a report on that. It was very interesting. It doesn't sound like it's something that we expected. It sounds like a crisis assessment center is more along the lines of what we're thinking we need, but it was very interesting.
Nothing to report.
Nothing to report.
I was contacted by 2 board members from the Mendocino Coast District Hospital. They were approaching me and Sheriff Allman on providing crisis stabilization units. One was within the hospital. One was mentioned for the Affendito building. So there were more solicitations that these facilities are available, and I don't know that there was a lot of thought put into it. I responded by mentioning that we were bringing a RFQ, RFI process, and if they're interested in providing those services, they come to us with a proposal.
Nothing to report.
Which brings us to the close of another meeting.
Carmel, does Carmel have anything to report?
Oh, Carmel?
Nothing further, thank you.
Oh, further communications let's see, regarding
The only thing that was received was the letter from Emily,
right.
and that was after the publication of the agenda.
Oh, I see. Okay, so that brings us to the close of the meeting. I move we can adjourn now.